Hello, Patrick. I want to talk to you about performance anxiety today. But before I get into more detail, I would like you to um, work on this scenario or imagine this scenario with me. So imagine that you're standing on a stage in front of thousands of people. You're about to give this important speech, and it's the moment that you've been waiting for. You've practiced for it, you want to do this, right? But all of a sudden you froze as soon as you see all the lights shine at you, all the eyes on you. You didn't know what to say. You forgot all the things that you practiced for. You may start shaking. That's what we call performance anxiety.
That feels familiar. Can you explain a little about what anxiety is?
Yes. So anxiety is when the part of the brain, the amygdala, senses trouble. It may be from the real situation or your imagination. And when it does sense trouble, it releases hormones, the cortisol, which is the stress hormone, and the adrenaline for the body to know what to do in that situation, right? So you might have heard the fight or flight response. It serves a good purpose and helps us survive because when our brain gets that message, then we know what to do in a situation where we have a cue that it might be dangerous.
So, like you said, it sounds like anxiety actually does serve a useful purpose. So, why do people worry about it as much?
Yeah, some people. So for a normal brain and a healthy brain, I would say we all can handle and manage anxiety. For some individuals, if the anxiety level is too high to the point where they feel like they can't control, then that can impact their daily functioning. But when I say like it serves good purpose and it can help us actually like perform really well, I want to explain to you a little bit more about this. So think about this: if you have like exam coming up tomorrow, if you're not worried or stressed at all, then of course you're not going to study for it, right? Because you're like, well, okay, I don't have to worry about it at all. Then when you go in to take the exam, you may not perform as well just because you didn't study for it. On the other hand, if you are too stressed or too worried, too anxious, no matter how well you study for it, when you're taking the test, you may forget about what you studied. You may not focus as well. You may start shaking, can't breathe. And again, it impacts your performance. So when I said like a little bit of anxiety to help perform at the optimal level, meaning that when you are stressed and worried about it, you're like, oh, okay, I have to do something about it, right? So you get yourself to study for the test and try to like, memorize things. And when you're taking the exam, you know that, okay, you are a little bit stressed already, maybe start to experience some physical symptoms and you overpower it, you try to manage it, then you're likely to continue to perform and perform well.
So, how do I know if my anxiety is at a healthy level?
That's a good question. It's hard to know, right? Because we don't have like a scale where we can step on and know like, hey, this is healthy level. Now, what we can do is to be aware of our physical and emotional symptoms. So there are different signs and symptoms that can help us realize that this is anxiety. So for example, you may start shaking, might have a lot of people say like they have increased heart rate. They can't breathe properly. They start to sweat. They can't focus. They can't think straight. So these are the things that if you realize and you feel like, oh my God, I'm like experiencing these things and I feel like it's out of my control, then you can start to use different strategies in the moment to help you manage and be calm.
What are some of those strategies?
There are many different strategies. Um, Meditation can be one of them, and a lot of people are encouraged to practice meditation. Meditation is, shown to help change the brain physically over time. So, you can better manage the symptoms and aware of the symptoms in the moment, right? Grounding technique. So, grounding technique is pretty much try to distract your worry thoughts and focus on your five senses. Would you like to practice that and maybe
Sure.
like try that a little bit? So Yeah. Tell me about your experience at this time. Like, what are you feeling using some of the examples of the five senses?
So, in a situation where I would be very anxious, I would feel my senses heightened.
Mm.
Right, I, I, I would, I could possibly even hear the aircon, the airflow, and the aircon. You could see me observing objects in the room, the white on the wall,
Mm.
and things like that.
Exactly. So that's right. Like what you described to me is trying to use like different senses and try to refocus, right? Like try not to think about like those worry thoughts and stressful thoughts and refocus on like, try to bring try to bring yourself back to where you are now. And you describe all the senses that you're experiencing, that you're feeling in the moment. Yes. The other strategies or other ways to help manage anxiety can include seeking professional help. Um, in psychotherapy, CBT, cognitive behavioral therapy, can be a helpful way and useful way to help work with symptom management. Basically, working with irrational thoughts that lead to irrational behavior. In some cases, they might need help from medication in addition to psychotherapy as well, just to help them manage symptoms that are more severe to the point where, just strategies themselves may not be as effective or as helpful. So these are some of the strategies that one can use when they start to feel anxious to help them perform or reach optimal performance.
Thank you, Dr. J. This has been very helpful. Thank you.
Thank you.